This is Jerry Hesch. I'm demonstrating a client who presents with a posterior shift of the pubic structure, and I hope that you'll be able to visualize that. But here's a skeletal model, and basically the entire face of her right pube is forward, or the left is backward, and actually the left is backward. Now, a person could lie with their pelvis twisted, okay? And if that were the case, then the face of the pubic bones would be flat as you walk across it. Actually, what happens with her, and I know this client, I've treated her a couple of times in the past, I know her history, and this is a recurrent issue from a pretty severe injury. We've taught her self-maintenance, and she was doing it for some time, and it was working, but it's time to resume doing that periodically. And here is the very top of her pubic bones, and I like to walk across them. I don't feel any step off. I palpate 3 different portions of the pube. I'm at the lower pube now, so if I went any lower, it would be culturally inappropriate. In other words, we'd be in soft tissue land, etc. Okay? So this is the right side, and it is anterior. When I come and walk across it, right there, I fall down. My thumb falls into a depression. And when I come from here, I have to climb up. Did you feel that with your thumb?
Yep, absolutely.
You could feel that?
Yep.
Very good.
Exactly the way you described it.
All right. Now, you cannot have that much shift in the pubic joint without having some shifting in the sacroiliac joint. How old were you when you had that terrible horse injury?
18.
18. So your SI joint was not fully developed. Maybe it was, but maybe not if you read the literature. Bowen and Cassidy's gorgeous study, 1981 Spine Journal. He looked at each decade of the SI joint. I would submit to you that it was not fully formed at that time. So it was still vulnerable, and it was an absolutely brutal injury. Now the way that it manifests with her is when she is in flexion, such as child's pose, this ilium, like the ischium, is posterior, and I cannot spring the ischium in anterior glide, and the ilium, and I cannot spring the ischium either. So I'm going to show that to you real quickly, and then we'll get her in child pose, and then we will stop filming and treat her, come back and film and show the benefit. Okay? Thanks. So let's get you on your stomach, please.
Oops.
In this position, she actually does have, pretty good mobility when I put passive forces through the pelvis, and you don't see that asymmetry. It truly exaggerates when she gets in flexion, and the sacrum moves on each side. There's no torsional pattern, and I cut the pelvis in thirds. Okay, PSIS is right here at the bottom of the upper third. At the top of the lower third is inferolateral angle. Right above that is the sacrospinous ligament, and you have to go up and down. Sacrotuberous is here. But right now, if I indent the right sacrotuberous, it indents. The left one is very hard. It's rock hard. When I try and spring the ischium, it does not spring. Could you get up on all fours and sit back with your feet off the table? And go ahead and bend forward. In this position, there is no sacral restriction. It moves nicely. I've already done the testing. 4 quadrants, 2 sides, upper and lower. But what I do find is that this PSIS is posterior. Okay? Now it's not a posterior rotation, because she wouldn't have this spring mobility. This movement goes through that and into the body. Where she's blocked is right here, and my force vector is pure PA. So we call that posterior glide of the ilium. Okay? So the entire hemipelvis has shifted posteriorly. And it's an easy correction, but we take a long time to make the correction. We take 5 minutes to glide that thick fibrocartilage. You know, muscle energy techniques just don't work for this kind of a presentation. We're dealing with a dense connective tissue. I'll do a traditional one just to see if she's the exception and it works for her. I sincerely doubt that it will. Now this creates a compensation somewhere in her upper body. I'm going to skip filming that for now. I'll take a look for it and then see how it responds. Typically the compensation is going to be on the right side of her body, further up, might be as high as the upper cervical spine, and she is having some neck pain. So I'll stop filming here. I will come back and film the treatment results.